Okie dokie. I think we are good to get going. Let's just make sure everything's looking good. I think we're looking good. Just to double check a couple more things. Let's see here. How are we sounding? Looks like we're sounding pretty good. Everything seems chill so far, right? I think we're good. So we're just going to share it on ye old Twitter. And after we share it, we will get going. Okie dokie. Here we go. Oh boy, typos. Okay, I think we're good to go. Here we go. All right, everyone. Okie dokie, here we go. So, good afternoon, everyone, or good evening, or good morning, whatever you are, whoever you are, wherever you are. My name is Dr. Patrick Lockwood, and this is UnShrink Me. And for those of you who are brand new, UnShrink Me is a podcast about all things psychology, mental health, so on and so forth. And the spirit of what we're here to do is to take a critical look at everything pop psychology and everything that people are espousing as is clinically useful, even though it may or may not be. So the idea, the ethos of this podcast is criticism for the sake of creating the most informed consumer base possible. Protect the people who are seeking out services. So I am here trying to sometimes be funny, sometimes just be critical to help everyone who sees this make better choices for their mental health when they seek out a therapist, a psychologist, a psychiatrist, a testing psychologist, whatever. I just want you to get the most out of it so you're not taken advantage of and you get the most bang for your buck and you actually get better. That's what I care about. That's literally all I care about. I don't care about politics. I don't care about fame. I don't care about any of that shit. I care about you getting everything you need from the professionals, supposedly professionals, that you're supposedly working with. So that's why I'm here. If you find this helpful or interesting or etc., please like and share and subscribe so we can get more and more people, more and more quality information and appropriate skepticism about their mental health services. That's why we're here. So thank you for joining and watching. We have so many topics today that we're going to talk about. We're going to talk about men and mental health. We're going to talk about personality. We're going to talk about, what else are we going to talk about? We got some good shit on the list today. Let's see here. Also, I curse a lot, which is so unprofessional, but who cares? We're going to talk about psych meds. We're going to talk about, anti-psychiatry bias. We're going to talk about all sorts of fun stuff today. So please stick around and please enjoy the ride. And as always, if you would like to comment or share an opinion, please feel free to do that because all opinions are welcome, even opinions I don't like, and especially opinions I don't like. And as always, this podcast is not NOT sponsored by Celsius, but I love Celsius, so thank goodness for this. All right. So something that I was hoping to get to last week, which I didn't have any time to get to, unfortunately, because we were on a sick one, is I want to talk about friendships and feelings and mental health. So my first discussion today is about friendships and feelings and mental health. So I'm going to repost this because it's on the more controversial side of things. So we'll see. We will see. But maybe it won't be controversial. I don't know. Let me see if I can find it here. Okay. All right. So here it goes. So I'll give you all the background and all the context so you know why I said what I said. Okie dokie. So as always, one of the people that I interact with online, another clinician, and her handle, I believe, is at NoBSTherapist. And her handle is at TweetATherapist. She put out a post on 7/14, July 14th, that said, in quotes, "They trauma dumped on me." And her response was, ... You mean that friend talked about something difficult in their life? So the spirit of what I believe she was trying to say is, when people use psychology-like or clinical-like language, like so-called trauma dumping and things like that, the principle is that people are unintentionally vomiting feelings. And they're doing it in a way that's not so helpful. Oh, hello, my chatters. I see we got Jonathan Cogburn and the mathematician Arithmetic here. Awesome. Glad you're here. So I want to hear your opinions on this too, because I think you'll have something interesting to say. So again, her original post was about trauma dumping, and her critique of the concept of trauma dumping is like sometimes your friends are just talking about something important to you, which makes a lot of sense because when you are friends with someone, they're going to tell you about difficult things. And so my rebuttal was specifically, some people non-consensually vomit their feelings. And this got me 64,000 views and a bunch of hate from people, essentially. Now, NoBSTherapist did not respond to me specifically, so this isn't directed at her or anything of that nature, just so we're clear. But I want to try and stake out some territory. So the topic here is friends, feelings, and boundaries, right? And so for your mental health, what kind of relationships do you have with your friends? And there's different cultures with different beliefs, so I'm not trying to speak for the entire world or something like that because I'm not that brilliant that I can. What I can tell you is that most people, especially in a Western context, tend to have more casual relationships with their friends, like acquaintanceships is typically what they're called, or they have deeper relationships with their friends, where they talk about serious emotional things and fun emotional things and challenging things and etc. And so most people, when they use the word friend, they either mean acquaintances, which are loose and casual, or they mean like deep, deep, deep connections. And so for the people that you have deeper relationships with, I can completely understand when you have difficult conversations with people, for sure, right? You might need to vomit some of your feelings. You might need to say a bunch of shit that you're struggling with or going through or whatever, and that's okay. And that's totally okay. And there's nothing wrong with that, especially if it's consensual. So when I use the phrase, some people non-consensually vomit their feelings, I think that got a lot of people upset because I think a lot of people took it to mean something like you're a cold-hearted asshole if you don't just sit there and listen to people who are rambling about how they feel because you don't really love them or care about them very much. So this is the problem, which is every relationship is different. Everyone's built differently to some degree. However, I want you to think about the concept of consent. Like in everyday normal conversation, most people genuinely are not just like, dump on me, it's fine. Most people, there's a normal flow, there's an ebb and flow to conversation, and there are expectations based upon your prior history with the person that set the tone and set the table for what kind of talking is okay and acceptable. And at least in the West, most people are not okay with just a friend of theirs, even if they're a good friend, randomly out of nowhere just dumping a bunch of stuff on you. Now, if you're talking to your friend and your friend's like, I'm really going through it, and then you say something like, oh crap, is everything okay? Tell me all about it. Then of course that's permission, implicitly or even explicitly, to talk about all your feelings. So when I was saying what I was saying, some people, not everyone, some people non-consensually vomit their feelings, there's a small subgroup of people out there, typically with personality disorders or a bunch of trauma, who have no capacity to regulate themselves in relationships. And they take advantage of their relationships selfishly, unintentionally usually, because they're not aware of what they're doing. And they are literally vomiting as if like a drunk person came and vomited on you unintentionally, right? So they're not maliciously vomiting on you, but like you go with your friend to the bar, they get too drunk, they go kind of a little too hard, and they accidentally vomit on your shoe or something. They're not being malicious. And it's just like, it's not a big deal when sometimes people accidentally go too far or kind of violate a social norm or an expectation in your relationship. So I wasn't trying to say that most people are selfish assholes who just don't take any consideration about other people and just vomit their feelings. I said some people, and I'm specifically talking about the more pathological types who don't fully understand the difficulties of having a more one-sided relationship. There's tons of people like that in the world. Now, it's not like half the population or even a third of the population, but there's a small subset. And if you're in the right subset of the world, you're in like entertainment industry, modeling, sex work, therapy, whatever it is, you're going to deal with more sick people more often. You're going to see more of those types who violate cooperative conversation, which is funny because like my second post underneath that tweet was about Grice's maxims of cooperative conversation. So my post is consensually vomit if you want, but non-consensually, like if your friend's not into the conversation, don't talk to them about your feelings. Seems pretty common sense. Let's see what the chat has to say. Our mathematician says, I looked at the post. I believe there's a time and a place for such things. Of course there's a time and a place, right? Of course, we all do that. We all need to like talk about how bad we're doing or what's going on. However, some people violate the typical consensual boundaries in conversation, for sure. Jonathan says, if the story shared is too close to home for the listener, like hearing a trauma story that drags up your own, a boundary may be good. But the listener should let the friend know about the impact and initiate the setting the boundary. Right. So part 2 of the tweet that I probably should have said is, if you don't like the way someone is talking to you, set a boundary. It's the most common sense thing in the world, but so many people struggle with it. People are afraid to set boundaries, which is an entirely different conversation. But I promise everyone watching and listening that if you make the conscious choice to negotiate, to assert for yourself what you believe you need in the relationship, you are treating yourself and the other person with more respect. It is disrespectful to people please people just because you quote unquote feel bad for them. If you are honest with people and you're like, listen, I can't talk to you right now because I'm not currently in the headspace where I can handle it, that's okay, right? Because maybe if that person's really struggling and you sacrifice your boundary for them and then you give them shitty feedback because you're distraught yourself or tired or whatever it is, then you're just being a terrible friend. So do not people please people is a pretty good injunction. It's really not helpful if you're not in the right headspace to try and be there for people because you're going to suck at being there for them. Mathematician says there are some people who cannot read the room or situation and they just start to vent and or rant. Exactly. And those people are the people I'm talking about with this post. Some people do not want to be vented to, right? I also agree. This is fine. I would not call it consent, yet I know what you are choosing the word for. Yeah. Exactly. So I think generally my point's common sense, but I got all sorts of hell for it, which is totally fine because her post was intentionally, I think, vague because she had a point she was trying to make for a certain demographic, and I was also vague. So for whatever it's worth, I would say, having clear boundaries around communication is generally a good thing, especially in therapy, by the way. If you don't like how your therapist talks to you, if your therapist is not having healthy boundaries with you, then something is wrong, right? That's a problem. that needs to be challenged. Because sometimes in therapy, some therapists will just let people vent and vent and vent for sessions and sessions and sessions. And there's a time and a place for that even in therapy. But the problem is, too much of that is not productive because then you're never doing anything in therapy. So if you're going to multiple sessions and just venting, and your therapist just listening, going, oh, that's so hard, and they're like normalizing and empathizing and stuff, you're not getting anything out of therapy typically. So just be careful about the concept of venting and vomiting and things like that. Okie dokie. What's next here? Okay, great. So next post we're going to talk about, let me retweet it right now so everyone knows what I'm talking about. Okie dokie. So one of the psychiatrists online that I appreciate is a gentleman named David Puder, and his handle is at DAVIDPUDER. And he put out a post on July 2nd, weeks and weeks ago. Sorry I didn't get to this sooner. And it went like this. He said, future therapists may ask how do you not take home the emotions and situations from your patients? And he said, I used to say, work through your countertransference or personal therapy. Yet, patients are often in my mind. I can't read, hear music, watch a movie without thinking of them. For example, second post. I was sent this from a cohort member. If you're a therapist and this reminds you of someone, and he quoted a song. And so I want to talk about this because this speaks to like how healthy your therapist is. And as I've said many times, the whole point of this podcast is to protect consumers from people who are unhealthy, who aren't trying to improve, who need more supervision, who are unethical, etc. So, therapist burnout's a real thing. I have an entire business dedicated to that, which we can talk about sometime. But the problem, or one problem, as he alludes to here, is the concept of taking your work home. And so if you're looking for a new therapist, a good screening question that you should ask them to see if they're healthier people is about this. Do they take their work home? Right? Something in that category. Now, what David said, which I do respect and appreciate, is that he used to say, work through your countertransference and get your personal therapy. But then he followed it up with, but sometimes patients are in his mind, right? He didn't use the word sometimes, but I'm interpreting sometimes. So here's what I will tell you. 15 years in the industry, done my own therapy, and supervised a lot of interns, et cetera, et cetera. I've worked with very, very ill people, acutely ill people. Occasionally, I will think about a former patient or a current patient or a coworker or whatever it is. And all of that is, I think, within the bounds of what's normal, typically speaking. However, if your therapist is the kind of person who goes home and worries about you, if your therapist is the kind of person who says things like, I was thinking about you the other day, etc., and they do that on a regular basis, then you're not having a healthy relationship with that person. There's something up with your therapist such that they don't have appropriate boundaries with you, right? So he's correct when he says you could manage your countertransference better or go do your own therapy if you're that kind of therapist. So really the question is, to what degree do they take their work home? Because full disclosure, I've had some moments in my career where I worked with very, very suicidal people, and I was worried about them dying because maybe they were in transit to the psych hospital or whatever it was, right? And so sometimes there are genuine psychiatric crises that I worried about. However, if you're a private practice therapist and you're not dealing with acutely, severely ill people, which you probably shouldn't be anyways, and you're worrying about people or thinking about them a lot in between sessions, I think something is wrong with your boundaries. I think you have a different view of either the relationship with that particular patient or an incorrect view of what it means to be a therapist. Because generally speaking, our ethics code says we are to have only one kind of relationship with people, which is a professional relationship. And so the more meaningful the work is, I think, the more it means something about you, not about the patient, right? So everyone who comes into clinical psychology, no matter the degree, master's, doctorate, psychiatrist, whatever, is here because they care about people, blah, blah, blah. And so it is meaningful existentially and personally to some degree. However, if a large source of your meaning is from your clinical work, then something is wrong, in my opinion. And the reason I believe that is because, number one, if a large chunk of your meaning comes from your clinical work with other people, that means that those relationships with those ill people means more than other relationships in your life. And that's not okay. My experience of supervising interns is I want you to have the healthiest possible life outside of your professional world. Healthy family, friends, romantic partner, hobbies, physical health routines like exercise and sleep and food and diet and all these things. Because if you're doing the job correctly, in my opinion at least, you're taking care of all the personal things that keep you sane so you can be the best possible clinician. And so if you're not taking care of your sanity outside of work and you're making work more important than your sanity, then you're a shitty clinician. And it's that simple. You are too focused on saving people. Maybe you have this narcissistic hero complex where it's like, I'm saving my patients, which most private practice therapists aren't saving anything, just so we're clear. They're helping people, but they're not working in acute crisis management care like people like myself and others work in. So let's be clear that, like, if you have some kind of God complex, especially a private practice therapist where you're like saving people, you got some work to do. You've got some narcissism or something that you're not addressing. But secondarily, if the work is more important than other personal things, then your priorities are screwed up. And it's that simple. Because if you're not taking the best possible care of yourself, and I don't mean you shouldn't work hard and care about your patients and bust your ass to be smarter and more ethical and better at managing your countertransference, I think you should invest all sorts of time in becoming the best possible clinician and knowing as much as you need to know, training, supervision, all of that. I think you should really work hard to be the best possible therapist. But part of that is taking extremely good care of yourself. Because the more screwed up you are, the more you're going to screw up your patients. And it's that simple. And I'm going to say that one more time so everyone can hear it. As a clinician, as a psychiatrist, a psychologist, an MFT, LPCC, LCSW, whatever your degree, I don't care. I don't care how smart you are. I don't care how rich you are. The more screwed up you are, the more you're going to screw up your patients. So maybe you should unfuck yourself. Maybe you should take more time taking care of yourself, getting your needs met in your romantic relationship, getting your needs met in your friends, getting your needs met at the gym, in your diet, in your sleep. Maybe you should do everything you can to have the most grounded personality possible. And listen, I curse and pretend to be professional and stuff, so clearly I'm not super grounded, but I've also seen enough interns who are like, I was so worried I couldn't get them off my mind at home. It's like, you can't live that way. It's terrible for you. And every time I've been in supervision with my interns and they're like, I can't stop thinking about it, and then I give them the feedback that I'm giving you all, they go home and they figure out a way to disconnect and stop personalizing and taking responsibility for the patient's feelings and stuff, and then they get better. And then they have better boundaries with the patients, and their clinical work gets better. And so what I'm telling you is not to be mean or condescending. It's just like, genuinely speaking, these people have no clue. The people who are saviors of their patients, the people who are curing their patients or whatever, These people have their own personal stuff, their own personal needs to feel powerful, their own personal needs to feel smart and important. They're getting those needs met pathologically with patients. Every therapist, just so everyone knows, every therapist who does therapy is getting some personal needs met by being a therapist. They're getting their needs met with feeling powerful, feeling smart, feeling important met. Every one of them. But there's a pathological variant of that. So it's normal. But the pathological variant of that is, I am so smart. I am so special. I am so important. I am so powerful. I am so capable, etc. That these patients need me. And that's where pathology starts to live. And so it's very, very, very important. I encourage everyone to be very careful when you have a therapist who says, I've been thinking about you a lot. If your therapist says, I've been thinking about you a lot, something is wrong with them typically. They're not taking good enough care of themselves. It's not to say that you can't think about people from time to time. I gave a couple of examples, but it's really not okay if they're quote unquote taking their work home a lot. It's not okay. You're going to burn them out. I'm dealing with someone right now in the industry who is very, very burnt out. He's a very good guy. He's trying his hardest. So a lot of my feedback to him to help him is to straighten some things out during the work week so he's not taking a bunch of stuff home and working 70, 80 hours a week when he doesn't need to. Sometimes you do, but rarely do you, especially in small businesses. So, for what it's worth, I appreciate you, Dr. Pooter. I'm not trying to come after you or anything, just letting you know. Alrighty, let's see what the chat has to say here. Mathematician says, I agreed. You cannot love someone well when you don't love yourself much. Exactly, right? So that old RuPaul's Drag Race saying of, how the hell are you going to love somebody else when you can't love yourself, or whatever it is like that? You know, that's true. Like, you have to be, it's our ethical duty as professionals to be free from pathology in a way that will interfere with our clinical work. It's that simple. It's in our ethics code. It's in the American Psychological Association's ethics code. The California Board of Psychology, when you apply for licensure or you reapply, you have to do your CEs, but you also have to attest that you don't have a drug problem, you don't have other serious medical issues that are impairing your clinical work. And so many people in the profession are sick. So many people in the profession are sick and they don't talk about it. There's shame and stigma. And maybe the way I'm talking isn't going to invite you to talk about it. And I apologize. That's not my intention. My genuine hope is that everyone in the business of whatever degree level, master's, doctorate, psychiatrist, whatever, that you're more honest about how you're struggling so you can do something about it and be accountable about it. That's what makes us awesome, is when we take accountability and we grow up and we do everything we can to help each other as a community. One of the things I love about many of the people I meet online, like No BS Therapist and Jonathan Cogburn and all these people that I talk to, is they're interested in things getting better. They're interested in supporting each other for things to be better. And the awesome thing about clinical psychology is it's the perfect group of people to help each other grow and get better. So there are certain pockets in clinical psychology, certain subcultures where people are genuinely interested in being healthier and managing countertransference better and taking better care of your health and all this stuff. And those people are awesome. One of the reasons I absolutely love the graduate program that I teach at is because all of my colleagues are acutely aware of what it's like to produce sick, not healthy clinicians. And so our collective ethos is, let's make sure these young people become the best possible psychologists. Let's make sure they have the best possible training to the extent that we can do it, and the best supervision so that they deal with their stuff and get better and do better. Yeah. Jonathan says, rising tides, brother. Exactly. We are going to lift each other up. And that is what is awesome about many people in the clinical psychology community, is you find the right people and we lift each other up. And you know what? I would go even further, and I would say that one of the things that's the most terrible about the profession is the lack of that attitude. I see it so often that so many people in graduate psychology, once they've graduated, during grad school, whatever, are so focused on making money or they're just burnt out from grad school that they don't even have the energy left over to be a good colleague. And that sucks because there's so many smart and talented people who could be awesome colleagues if they weren't so burnt out. And that is why I created this podcast. And that is why I have my consulting company. And that's why I want to help, because there's so many awesome people who have burned themselves to a crisp for the sake of other people. And that's terrible. It just doesn't work. There's a reason suicide, substance misuse, and serious mental health and divorce is such a big thing in all of medicine and all of psychiatry and psychology. We are some of the sickest people on the planet trying to help people. Nurses are some of the most psychologically and medically sick people trying to help people. And we need them so bad. And there's such good people who are so burnt out trying to help people. And that's terrible. Nobody deserves that. Now, you can blame the economy, you can blame capitalism, you can blame whatever you want. But at the end of the day, we are responsible for ourselves. And we are responsible to each other. That's why community is so important, because community keeps us accountable, but also we support each other and life gets better. Nobody loses. It's not a fixed pie mentality. Like if I give my colleague Jonathan 10 minutes on the phone and he gets better and his life is better, then everybody wins. That's 10 minutes perfectly spent. That's just a theoretical. That's exactly what we need. Mathematician says, me, I think I'm burnt out now. No, that's not good. You need to do something about that. Like, let's work on the burnout. Let's get it better, right? Like, again, this podcast is not advice to a particular individuals. It's just like, come on now. Like, you don't deserve that. No one deserves that. And that's why I started this podcast, to protect consumers and create healthier community in the profession. So many smart and capable people are burnt out and they feel disenfranchised. I had that years ago. It crushed a piece of my soul, and nobody deserves that. Nobody deserves that, because perfectly competent, capable people can stay competent and capable even in a very busy, demanding career. You don't have to be miserable to be successful. Not anymore. You used to, but you don't have to do that. So, all sorts of tangents. Da, 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 da. All right. Now, I don't know this person, so I'm going to discuss what they said very briefly because I don't really know them, so I don't have an impetus for analyzing further. But let me post about it real quick on Twitter and we'll get going. Okay. So this person's handle is Dan Coe. It's at TheDanKoe. So Dan said on July 18th, focus on two things. One, mastering your mental, emotional state in situations you cannot control. Two, realizing you can control more than you think and that you can improve your skill to the point of getting what you want. Give it 10 years and watch everything change. So this is very classically in the self-helpy, positive psychology kind of world. That's so good. But let me just reiterate what he said. So, two things you should focus on. Number one, learning to master your emotions while you're in the middle of a situation you can't control. Number two, realizing you can control more than you think you can when you're in that situation, and that you can improve your skill to the point of getting what you want. So that second piece is the tricky one. So the first one is learn how to manage your feelings when you're in the middle of a situation that's out of your control. Car accident, argument with someone, whatever it is. That's classic from the ACT perspective, the cognitive behavioral therapy, even the psychodynamic perspective. This is true. This is something you might talk about in therapy in a roundabout kind of way compared to this more positive psychology thing. So I don't see anything wrong with that first point. Now, there are some situations which are horrific, and so managing your emotions are kind of difficult. So, like, just to be perfectly clear, if you're in the middle of being traumatized, if someone's assaulting you, sexually or otherwise, your brain is going to automatically make decisions in the span of less than a second that are outside of your control, and there's nothing you can do. Your fight, flight, fright, fight, fawn, freeze, submit, whatever, 6 responses or whatever, like all of that's outside of your conscious control. Unless you're like a trained Navy SEAL, there's nothing you can do to manage those 6 things that your brain does when you're being traumatized. So, like, don't try to control that. It's impossible. So, what is in your control specifically is when you're not being acutely traumatized. So let's be clear that certain situations that are outside of your control are literally outside of your conscious, emotional, volitional control, like trauma, for instance. However, anything less acute and severe than trauma, you can probably do something about to feel better, which includes increasing skills like metacognition, or learning how to breathe, or learning how to refocus, etc. That's all fair, and grist for the mill in therapy in particular. So, short of like trauma, there's a lot you can do. So I don't want to generalize, etc. Now, to go back to what he said specifically, though, realizing you can control more than you think and that you can improve your skill to the point of getting what you want, that's the hard part. That's the hard part of good therapy, and that's the hard part of, most physical personal training that you do. So at the gym, or when you're learning a skill or a martial art or an art or whatever it is, most people believe that because of how they feel, they can't go any further. So they let their feelings dictate the boundary of what they can do, right? So I'm just going to use myself real quick. So today I ran 9 miles, and that's a lot of fun for me. It's also very difficult because I don't run every day like I used to. So when I run once a week, it's a lot. But at different stretches of my run, they're uphill stretches and downhill stretches, and it's a lot. It's definitely a lot here. I can make the conscious choice to be like, wow, my legs are sore, my breathing is struggling, whatever it is, I'm going to not push so hard so I can feel better. Or I can make the conscious choice to push just a little bit harder, get a little bit faster pace, and get the run over with quicker, if that's my goal, right? And so that kind of thought process I just outlined is true across many challenging situations. When you're learning a skill, when you're learning to overcome trauma and anxiety and stress and depression, most people believe falsely, specifically, that their emotional reaction is the boundary. It's the limit of what they can do. But the truth is, you can look at every military training academy, police training academy, martial arts training academy. There's so many crystal clear examples. Good therapy teaches you that you can actually tolerate more than you think. You can handle more than you think. You are smarter than you think. You are capable. You are more capable than you think. You can work harder than you think. And I'm not saying you should kill yourself to feel better. I'm not saying you should work so hard that you exhaust yourself and burn yourself out. I just said don't burn yourself out, right? So I'm not saying push yourself to the point of burnout to feel better. What I'm saying is people's natural emotional reaction is, wow, this is too much. I can't do it. I'm going to give up. And so what he's saying is, once you start to see that if you push yourself just a little bit harder, you'll get a little bit better and it'll be easier to handle that thing you thought you couldn't handle, then you'll see you're more capable than you thought. Math Magician says, kudos on the 9 miles. Absolutely, thank you. It's one of the things I love to do. So he's correct, but just be careful about the certain situations in which you can or cannot do that. What's next here? Yeah, just to carry on the same topic real quick. A writer named Mark Manson, his handle's I am Mark Manson, on July 6th said, there's no such thing as good or bad emotion, only good or bad reactions to emotions. Now, good or bad are moral words or whatever, but basically the idea is, like he said, your feelings are fine. They can be whatever they want. You could feel. That's the whole point of, just by the way, for all the conservatives and the anti-woke people, that's the whole point of affirmative therapy. It's not to say that you shouldn't feel that way. If you're trans and struggling with gender dysphoria, like, it's okay that you feel that way. That's what affirmative psychotherapy is. You don't have to get rid of that feeling right now to be okay. You can be okay with that feeling, by the way, right? So it's either your reactions to your emotion make your life better or they make your life worse. Your emotions are whatever they are, and it's fine to have them. Okie dokie. Okie dokie. Let's talk about this post from Lisa Britton, I guess. This was posted 5 days ago, so I'm going to discuss it right now if I can, be on top of something sort of current. Okie dokie. So this is what Lisa posted about 5 days ago. And her handle is at LisaBritton. She said, research found that dropout rates for men in therapy is around 44.8%. Why are so many leaving treatment? Many say the format and framing of the sessions didn't align with what they need. We have to have more male-led, male-focused therapy solutions. What are your ideas? And so I don't think I said anything specific about this posts, but let me just say a couple of thoughts because men matter. And as a dude who's been both in therapy and been a clinician and just generally been in the industry for 15 years, I see generally what she's talking about. So if a lot of people are dropping out of private practice or something like that, I wouldn't worry as much. But let's talk about this. So why do about half of men drop out of therapy? Well, a lot of people drop out of therapy for dozens of reasons. You know, bad therapist fit, lack of skills and training. Like I've always said here, lack of countertransference management. The therapist has too much of their own stuff. Some therapists are just lazy. Some don't know what they're doing. I mean, there's just so many reasons why people drop out. But also, a lot of people come to therapy, and this is a great post by Jonathan Shedler earlier this week. I don't know if I saved it or not. But like, let me just double check and see if I saved it so I can retweet it too. No, I don't think I did. But anyways, what I would generally say is a lot of people will come to therapy because they want to feel better, or maybe even they want to get better, but they don't want to live better. They don't want to do differently. Because a lot of people believe erroneously that their main problem is their thoughts. And so let me be clear that yes, many of the psychiatric conditions we treat, like major depression and obsessive compulsive disorder and all these things, are disorders that involve a thought process which is counterproductive. Too many cognitive distortions, too severe cognitive distortions, etc. That's all valid. However, almost all effective psychotherapies, like ERP for OCD, is about behavior. What are you doing when you have the obsession? Right? So OCD generally is a disease where the individual engages in what's called pathological avoidance behavior. Every time they feel distressed, they do some obsessive compulsive thing, this behavior, to neutralize, to avoid the feeling, right? So the classic example in OCD is very severe germ phobia, right? And so whenever they're having really intense anxiety because they're obsessing about it, germs on their hands, they go wash their hands ritualistically for 10 consecutive minutes and start to bleed, right? So they're pathologically trying to avoid and neutralize, right? People with OCD are pathologically trying to avoid and neutralize their intense anxiety, not tolerate it. So when you do exposure therapy, ERP, with patients struggling with OCD, what you do is you teach them how to tolerate in increasingly larger doses the anxiety that comes with their illness, as opposed to pathologically avoiding it. And so many people come to therapy on the less healthy side, wishing to just change their thoughts and never do anything differently. But the problem is you have to live differently to feel better. You cannot think your way to mental health. I'm going to say that one more time. You cannot think your way to mental health. It is impossible. It is all about doing. It's about talking differently, or moving differently, or talking more, or talking less, or whatever, or working out more. There's so many things you can be doing to feel better. And so one of the reasons why I think therapy is difficult for men is because a lot of people, when they do talk therapy, genuinely believe they're just going to talk to their therapist and feel better. And that's very limited, especially for men. I think I talked with Ryan Rogers about this on his podcast a couple of weeks ago. I think men need therapists who are more interested on average in going out and doing something, going and practicing a skill, right? CBT is about going and doing something. A thought record is about doing something, right? Not just talking and analyzing. Talking and analyzing is somewhat useful, but in the context of never going out there and doing differently, you're wasting your time. If your therapy is navel gazing, you're probably wasting your money. If you're in therapy for years and all you do is really talk and you never go apply anything in the real world, you've wasted your time and your money. Jonathan Cogburn says, Patrick knows I'm on vacation from private practice and working on an agency training and supporting educators, mostly for time with my family, but also to be a better provider. Insurance. Good. Yes, you're taking a break and you're trying to do it better for yourself and everyone else. Or lack thereof is constantly working against me and the profession sucks. Exactly. Math Magician says, the reason I left therapy time and time again as a female is because they pushed medicines instead of teaching or showing me active ways to get better and or work through my issues. Right. So in your case, you're saying you left because they pushed meds and talking as opposed to doing, right? And Jonathan says, many people needed both, by the way, and your reaction's reasonable. Exactly. A lot of people need meds. I am not anti-meds. I'm teaching psychopharmacology right now to MFTs. Meds are great, especially for people who are severely ill, people who are struggling with severe versions of psychosis, bipolar, depression, etc., or PTSD. Meds will help for sure. Severe insomnia? Absolutely. There's so many good use cases for psychiatric medications, right? So the problem is when you exclusively only do one thing. That's terrible because that's not what the research says. The research does not even say just medicate the problem away or just talk the problem away. It says that nowhere. So it's very important for people to do more than just talk therapy. You have to go out there and do something because of your talk therapy. So if your therapist is just interested in you feeling better without doing anything differently in your real life, I don't know if they have your back. Because sometimes there's nothing you can do about an outside circumstance. Sometimes, the people around you are so sick and they don't get you that you need to find new people. But that's doing something different. It's finding new people, right? So there's so many examples of how therapists just want to talk. Because unfortunately, and I tell this to my graduate students all the time, many of you came to the profession because you like a good story. But therapy is not movie time. I'm going to say that again. Therapy is not movie time for the therapist. Therapy is your active involvement in a professional relationship with a patient to help them learn about themselves, learn skills, learn insights to go out there and do something different. If your therapist is just coddling you and is interested in you sitting there forever and doing nothing different, then you have a paid for best friend. And if your friend didn't encourage you to do something different with your life, your friend sucks too. So it's really important to be clear about what ethical therapy actually is and is not. Because genuinely speaking, there are well-intentioned people who just want to sit there and listen to a good story, and that's not therapy. And I think in particular, the reason I started this whole rant is because men drop out of therapy at larger scale more frequently than women. And so in my estimation, at least one of the reasons, of the many reasons, is because I think a lot of therapists just want to talk and have a relationship with you. And there's nothing wrong with focusing on the relationship. The problem is that the relationship has to be paired with some productive action out in the real world. Because human beings are not creatures who are designed to sit there and do nothing. Human beings are creatures designed to do things, to talk to people, to joke around, to laugh, to play. Play is super important. And if your therapist is like, oh, your depression's so bad, your PTSD is so bad, you can't go play, that person sucks as a therapist. Your job is to help people find a way to go live regular life on life's terms, despite their illness, and help them cope and get insight and get motivation to go do things, not to sit there forever. The trap people in therapy because the relationship is the most important thing model is garbage. Yes, the relationship is the best predictor of treatment success, but the relationship alone is not what helps people get better. It's the relationship that encourages people to have a new experience of themselves so they can go out into the real world and live differently. And it's absolute garbage when therapists just want to sit in the story with you or let you vent every week or whatever that garbage is. That's not therapy. That's having a paid for voyeuristic therapist, narcissistic therapist. And that's not therapy. So you know you have a good therapist when they're interested in having a healthy, ethical relationship with you that encourages you to grow and go live differently. That doesn't mean it happens quickly. Some people need to take some time to change. And so it's not like your therapist is a guru life coach who just tells you what to do and you go do it and your life is better in 30 days or some Tony Robbins shit. A good therapist builds a good relationship with you over time and helps you, like scaffolding, if you know that term, gradually take on more stressful things in the real world and live differently gradually over time in the real world, not just in therapy. If you're only feeling better in therapy, your therapist sucks. They're not helping you. Your therapist is going to help you go live a better life in the real world. So I hope all that makes sense because I think men in particular would benefit from clinicians and providers who are more interested in helping you go live a better life now. Now, we can't do the car salesman thing and promise people a better life tomorrow or next week or the week after. That's bullshit. What we can ethically say as clinicians is we are here to have a professional relationship where we help you develop motivation, insight, and skills to address your clinical problem that will allow you to go out into the real world and live a better life with regard to that clinical problem. And that's it. I am not your guru. I am not your spouse. I am not your preacher. I'm none of those things. I am just a professional who has this set of skills designed to treat these clinical problems that help you develop skills, insight, and motivation to address said clinical problem so that you can go out into the real world outside of session and live differently after every session. It might be tiny ways at first because you're struggling a lot, which should get bigger and bigger and bigger over time. You should practice more and more and more over time the new insights and skills and motivations that you're learning in therapy. So, there's Max back there. He says hi. He's about to take a nap. Anyways, I think I've ranted enough for today. But, for men in particular, find you a therapist who will help you go do differently, who will have a good relationship with you and do good talk therapy and do good behavioral therapy that will allow you to get out into the real world and start living differently. And you can demand that of your therapist. Don't take the expert's opinion just because they're the expert. You can demand more of your therapist. You're paying all this money. Your insurance is paying this money. You're paying cash, whatever it is. Demand more of your therapist. Get what you need from them. Sometimes it's reasonable, sometimes it's not. And that's what you get to talk about in the relationship. An ethical therapist will be like, okay, you need this. Let's figure a way out to help this. And if it's doable, we'll do it. And if it's not doable, we'll work towards it. And if it's impossible, we'll find another solution. That's ethical therapy. All right, I'm done. I'm done for the day. I've done everything I can to save therapy or whatever. So I really appreciate you all coming out and chatting and watching. A number of you are watching silently, which is fine, totally great. I really appreciate everyone who's here and contributes and shares their thoughts and feedback. It really makes this more fun and engaging. And I really hope that everyone gets the spirit of this podcast. The spirit of this podcast is very straightforward. All I care about is creating a more informed consumer base. I want everyone who's seeking out therapy, psychiatry, even coaching and shit like that. I want you to get the most out of these people. I don't want you to waste your time and waste your money. I want you to be protected from the scammers, protected from the people who just want your money, the people who just want a voyeur or whatever it is. And there's so much we can do in therapy and not have to come back for 5-10 years or whatever. So please take good care of yourselves. If this was helpful or interesting or stimulating or funny or whatever, please like and share and subscribe. I'd really appreciate it because I'd love to share this message with more people so that more people can be protected from bad therapists. So that the bunk that sold this therapy, you can see through the deception and the narcissism and the grandiosity and all the stuff that makes people pathological in the profession. So thank you all for being here and for chatting. And they also, in chats are saying there's a pathway to change, usually by walking through things. Exactly. You did a good job. Thanks for having us. Of course, please come back every Saturday. Love to talk with you more. So, as always, I try to end my podcast with a dad joke. And so, without further delay, here we go. So, I once worked with this patient. Really nice guy. Really, really smart guy. But he had this very interesting version of a phobia, which some of you may have heard of, but this was new to me, at least. So this guy I was working with had a special version of a phobia where he was terrified of leprechauns. I'd never seen this before in my life. So confusing. And so I did the intake and I tried to get to understand his phobia, where it came from, etc. I know trauma or something, so it just kind of came out of nowhere. And what you do when you have someone with a phobia, like one of the most effective interventions when someone has a phobia, is you do exposure therapy, where you intentionally, collaboratively create a hierarchy of the scariest thing to the least scary thing, and you work your way up the hierarchy to the scariest thing. So obviously leprechauns aren't real, at least to my knowledge, so you can't go like pet a leprechaun or whatever. So number 10 is not going to be a real leprechaun, but like maybe we can work our way towards it, like watching the movie Leprechaun or something. And if you haven't seen Leprechaun, by the way, shout out. It's a great, funny, terrible movie. So anyways, we created our exposure hierarchy. And one of the first things that he wanted to do as part of his exposure for his fear of leprechauns was go to the grocery store and walk down the cereal aisle and not avoid Lucky Charms. So that was our first exposure. So the following week, he came back and he said, yes, doctor, I went to the grocery store. I went to the cereal aisle. I even bought a box of Lucky Charms. And this happens in exposure therapy. Sometimes people go above and beyond what the assignment is. And he took the Lucky Charms home and he had a couple of bowls of them, and they're really sugary and marshmallowy, and he really loved them. And I told him that this was going to work because exposure generally works. And What he came back the next session and said was, I bought the cereal. I didn't walk away. I didn't panic. I was able to manage my anxiety, etc. And while I was having the cereal and staring at the box of Lucky Charms, the leprechaun smiling on the box and all this stuff. And I started to feel calm, even though I was having some anxiety looking at the leprechaun. I said, that's interesting. What do you think that means? And he said to me that he thinks it means that his fear is more manageable than he thought. And I said, you know what? It looks like the cereal is magically delicious. All right. Have a good day, everyone. Take good care of yourselves. Eat good food. Have good sex. Have good friends. And do everything that's good for you. I will talk to you next week. Be good to yourselves. Goodbye.